have a look at the clinical syndromes which are associated with this Pons. So there are two clinical syndromes. One is called as Millard-Gubler syndrome and other one is the pontocerebellar angle syndrome. So these are the two syndromes which are related to Pons. So Millard-Gubler syndrome. So this is due to the damage to the pons at its lower level. It is also called as medial inferior pontine syndrome. Okay, so the medial part and the inferior part is being damaged. So what are all the structures involved here? So this is the abducens nerve. So 6th cranial nerve is involved, and this is the facial nerve. So 7th cranial nerve is involved, and this is the corticospinal tract fibers which are passing through. So the corticospinal tract is involved. So the 6th, 7th and corticospinal tract are being involved. So because the 6th nerve is being involved, that is abducens nerve nucleus is being involved, there will be ipsilateral squint, because the 6th cranial nerve, it supplies the lateral rectus muscle, LR6, we remember it like this. Okay, so because that is damaged, it will lead to a same side squint. Because the 7th cranial nerve is damaged, there will be a same side facial palsy, ipsilateral facial palsy. And because the corticospinal tract is being involved, there will be a contralateral hemiplegia, that is paralysis of the opposite half of the body. So there will be a contralateral hemiplegia. So these are the features you see in Millard-Gubler syndrome. Now what about this pontocerebellar angle syndrome? So this is the area which is being involved in the pontocerebellar angle syndrome. So what are all involved here? This is the 7th cranial nerve is being involved, and this is the 8th cranial nerve, that is the cochlear division of the 8th cranial nerve. So 7th cranial nerve, 8th cranial nerve is being involved, and apart from this you have got the flocculus of the cerebellum will be involved and the choroid plexus. So this generally occurs due to acoustic neuroma. So acoustic neuroma is a tumor which arises from the Schwann cells surrounding the cochlear division of the vestibulocochlear nerve at a point where it attaches to the brainstem. So the compression features will occur. So because the 8th cranial nerve is being involved, the patient will have tinnitus. Tinnitus means continuous ringing in the ears. You feel that there is some sound being heard in your ears, continuous ringing in the ears, and the patient will have progressive deafness, and due to the vestibular involvement of the vestibular component of the 8th cranial nerve, patient will have vertigo. Okay, so these are due to the involvement of the 8th cranial nerve, that is vestibulocochlear nerve. Now because the cerebellum is being involved, the patient will have ataxia and staggering gait, and the 7th cranial nerve is being involved, patient will have same side lower motor neuron type of facial palsy, and then there will be a loss. So even the spinal nucleus and spinal tract of trigeminal nerve also is being involved in this pontocerebellar angle syndrome. So there will be loss of pain and temperature and loss of corneal reflex on the same side due to involvement of the spinal nucleus and spinal tract of the trigeminal nerve. So that is about the pontocerebellar angle syndrome, which is generally caused due to acoustic neuroma. And apart from this, there is one more clinical condition which is associated with Pons, that is pontine hemorrhage. So bleeding. So it will lead to pontine hemorrhage. So what will happen in this pontine hemorrhage? The patient will have pinpoint pupil. So if you put light in the patient's eyes and see, the patient will have a pinpoint pupil. So why this is there? Because the ocular sympathetic fibers are being involved. Next, the patient will have hyperpyrexia, that means fever, very high grade fever. So why patient will have hyperpyrexia? Because the body is cut off from the body temperature regulating centers in the hypothalamus because of this pontine hemorrhage. So there will be no temperature regulation mechanism, so patient will have hyperpyrexia. Next, due to the involvement of the reticular activating system, patient will land into deep coma. And then patient will have bilateral paralysis of the face and the limbs. So why is this? Because of the involvement of the corticospinal tract and the facial nerve. So that is about the pontine hemorrhage. So these are all the syndromes and the clinical conditions in association with the Pons. So thank you for watching.